Right, we're back again. Northerners United, another episode, real talk. We've got Kaleem on today. How you doing, bro? You all right?
I'm good, man. I'm good. I'm surprised that you invited a Southerner onto your program.
I know, that's the first one.
Man, you've already broken the rules.
That's it. You know there's no rules. But now, yeah, you're right, man. First Southerner on. But yeah, we're going international with this. We're going international.
It's below Milton Keynes, so like it's international now, yeah.
That's it. No, we're going to expand. Don't watch that. But yeah, we're going to talk today about life on the front line, moving out of home. Obviously, yourself will find out why you have done that and how COVID-19 will change our lives long term as well. But yeah, just a bit of context first with obviously the virus and how that does differ from the seasonal flu. It's 2.5 times more transmissible than the seasonal flu, so it obviously is more contagious. The mortality rate is significantly higher, and you've seen already 12 and 13-year-olds in UK and Belgium dying, and I think 5-year-old as well recently passed away in the UK. So no one's really safe. We're all vulnerable. But yeah, they say, don't they, that the health and welfare of the most disadvantaged is the health and welfare of all of us, because you never know when you're going to need that support and that healthcare. But yeah, man, obviously yourself, for the guys that don't know, you're a doctor in Watford, is that right?
Yeah.
And obviously you've been on the front line. So yeah, just talk on that and the kind of things you've been seeing.
Yeah, man. So it's it's a funny scenario because like you don't really it's just basically like the hospital's been preparing for war. They've been doing it, maybe it's about a month now, 3 weeks. They've basically just completely changed the whole structure of how the hospital is run. They've cancelled elective surgeries. They've redeployed people. They've brought in some people who are urology doctors. They've redeployed them to ITU. They're just sending they've already right now half the hospitals COVID wards. And the other half is just they call it clean wards. Yeah. And so it's like they're preparing for a scenario whereby the whole hospital will just turn into I don't know if there'll be any wards which will not COVID wards basically in Watford anyway. Yeah. So they've been just preparing for that, and it's just it's one of those things where it was like his winter was coming kind of thing, where you're just waiting for it, yeah. And then slowly now you can just see it now. You can just it's crazy how infectious the virus is, and the speed. I think the craziest thing with the virus is the speed at which the patient deteriorates, because you can speak to a patient and they might be quite well, they might be not requiring that much oxygen, and you can come the next day and they could have just passed away. And that's a scenario which a lot of people are going through at the moment. A lot of doctors, a lot of nurses, they're seeing that, and it's quite distressing, quite demoralizing, seeing that as well. But yeah, in essence, they've just basically just completely just reorganized the hospital right now, and we're just trying to do our best with trying to facilitate managing this virus. And I think in the future there's going to be a lot of hard decisions. They've already spoken to us about that, whereby there might be 3 or 4 candidates for one ventilator or for ITU or for something like that. And then I think that's a scenario which a lot of doctors are not looking forward to, just being in that. Obviously, I don't know. I don't think you'll reach the scenario where I'm deciding that. I think what they've said is they've got a committee of 5 or 6 people, including doctors and I don't know, someone else, a few nurses and a layperson, everything like that, to decide on that kind of scenario. But it doesn't sit easy with anyone who works in healthcare to have a patient there and for them to potentially not be getting a treatment because there's not enough of them. I personally haven't experienced anything like that thus far, but that's going to be another scenario. We're hoping with all the measures that's come into place now that won't be the case, because we're seeing a lot of people abiding by the the new rules set out by the government. And, I know people put out photos of like these individuals and everything like that, but when you go outside, you can tell the vast majority of people are complying by it. It's just, even if they're outside, they're trying to maintain their distance. They're a lot more cautious about, what's happening. People are wearing masks, everything like that. So that measure, hopefully that will flatten down the curve, and it doesn't get to the stage where you're deciding between people and saying, who's for NIV, who's for ITU, and that's a scenario which I'm really scared about.
Yeah, man, it's a bit of a madness, and obviously down south as well. We've heard that London has been hit harder than everywhere else in the UK. Yeah, so obviously a greater population, and there's like hordes of people on the tube as well. Until recently, people were going on the tube like it was still not, because they had no choice really, with their employers and stuff. That's what we've been hearing. But yeah, it's been a bit of a madness. Is there anything that you've seen that has like shocked you on the wards? Apart from, I know you mentioned, you spoke to, or you see people, or you treat them, and then the day after they're gone. But is there any kind of example you can give of something that's happened that was like just made you think twice and kind of reevaluate exactly what was going on?
I think there was. I personally haven't experienced, that kind of thing at the moment, because I'm still on one of the clean wards. I'm on the geriatric wards,
okay.
And there's other individuals who I've spoken to, and like I said, that's the story which they're saying is like they're saying that they're meeting someone, and they clock them in. They start the initial management plan. They start them on only 2 liters of oxygen, which is one of the lowest amounts that you can give to somebody through the nasal route. They start them on that, and then they come in the next day and ask them, and they say, yeah, the patient has arrested and he passed away. So it's just, I thankfully haven't experienced that myself, but a lot of colleagues are talking about similar scenarios where patients are just passing away, basically, just very, very rapidly. And it's just not predictable as well. Like, there's a lot of other people doing well. A lot of people make a good recovery. They go back home. And then some other patients who you don't really expect it, and then they just really have a bad reaction to the virus. They get the whole, what we call ARDS reaction, and that's basically it for them. Then they just, it's very sad. It's very, I think the thing that's on my mind a lot with this scenario is, I think the PPE scenario has been, for me personally, I feel as though
it's mad you say that, because I was just going to come on to that. That was literally my next point. I was going to ask you, like, what's the situation with PPE in your hospital?
Well, the situation is obviously we can't. The employers are not very keen on us talking about individual, how our individual trusts are and everything like that. But as a broad spectrum, I'll speak about that. I think, to be honest, I'm very, very concerned. I've heard a lot of stories about there's not enough masks. So what you need to do to get a mask, basically, you need to have a fit test. So they need to basically do a test on you and to see which mask fits you and which mask can protect you, whereby if you go see patients. Now, they do that test and they say, okay, this mask fits you. Then they go to that ward and they don't have that size mask. And they're telling them to wear another size mask. And obviously, there's no point of doing a fit test if you've passed for a certain mask, and that's the mask that will protect you. That's a mask for you to be safe with. And then you go to them, they run out of that, and they're giving you another mask. And there's other scenarios where they don't have enough masks, and I think Watford itself is actually quite good. I think there is masks available, but it's very sparse. And I've heard stories about other hospitals, and it's just a lack of I don't know, the resources or
preparation.
I think for me, the most concerning thing was the approach from the government. I think a lot of people will back this up. It has not been proactive. It's been purely reactive. They waited until the public opinion became that of which, okay, we see this as a serious virus, and then the government reacts to that. It shouldn't be that case. The government should have people advising them. I'm sure they have scientific advisors. I'm sure they have chief medical advisors. I'm sure they were aware of the risk that this virus posed. I'm sure they also advised them that this virus was going to come because of how interconnected the world is. The virus was going to reach is going to reach Great Britain. And what did they do? All I saw was 2-3 days before the quarantine, they let in a whole heap of Spanish fans, which is one of the worst affected countries, into Anfield. And, it just beggars belief. It just isn't. It's like a breeding ground. The Anfield that night must have just been a breeding ground, and loads of people must have just caught it. And it just, I think it's been purely reactive. I think it's been a lot of it's been based on economics. A lot of it's been based on politics. And I don't think enough of it was based on the sanctity of human life. I don't think they were trying to preserve people's health. I don't think they were trying. For me, it was just reactive. It wasn't proactive.
No, 100%. I agree with that. And we could go into that in more detail, and we'd be here for hours. But looking there in the background, I can see, obviously, you're in a hotel room. Just, tell the guys, a bit about why you're in a hotel room right now.
Yeah, so basically, man, it's the hospital's they've got a policy out, and it's very it's very useful for all of us at the moment, because when this first started, I think one of the things that at the forefront of all the healthcare workers and people on the front line was they don't want to go back home, and they don't want to spread a potential infection, especially if you live with elderly parents, or especially if you live with vulnerable groups of people. And that's a very, very concerning. So I think that they've had this thing where if you do live with a vulnerable group, and obviously I live with I live with a vulnerable group, and they thankfully provided some accommodation for me. And one of the members of my household also had symptoms as well. So if that is the case, they supply you with 2 weeks of 2 weeks of hotel accommodation. And obviously if you live with vulnerable people, then they'll also give you they'll also extend that as well. So I think that's been a really good thing in this scenario, whereby they've given us hotel accommodation. And I think that really eases it, because I was very, very concerned about just living with vulnerable people, living with other people, anyone. It doesn't even have to be vulnerable. Just living with anyone wouldn't sit easy with me. Just the potential to pass something on to them.
Yeah, 100%. It's that kind of fear of where you're putting your life at risk, and maybe you're not even fearing for your life as much, but then it's that transmission of onto your loved ones, and that's what you're scared about. And you're thinking, like, because the numbers that are dying daily now, it's getting higher and higher, and you're just thinking, what if, and you can't chance it anymore. Like, we've got to that stage where you can't even risk it, because you have to think of it like people that are dying today, they caught it maybe 2 weeks ago, maybe longer, and that's the problem. The incubation period and the understanding of the science, it can frighten you. So you have to take the ultimate precaution. And I think, you've done the right thing, bro. Like, I don't think you really have a choice, do you, really?
I don't know. As people have been telling me, oh man, you're living in a hotel, it must be nice. I'm like, well, if you think about it, it really isn't that nice. Like, you're away from your family, you're away from people you love, you're just stuck here by yourself. It's just go to work, come back. It's quite a solitary sort of lifestyle.
Yeah, 100% it is, man. It is. But I've got a lot of respect for you, man. Like, you and all of you, obviously, we've got a few friends between us that obviously are doctors as well. And, it's you hear stories of like the patients and the contact they come into, and yeah, it's like you're literally face to face with a lot of these patients, and you just, yeah, I don't know if I could do it. Like, putting my life at risk with the chance of, one of our loved ones getting it, it's a bit of a madness, because there's no other job really, unless apart from the army, there's no other job in the world that's really, that has that involved.
I think it's you take an oath. You feel as though like you've been trained to call up. Basically, it's just, you have a particular set of skills, and obviously you've always wanted to give that. You always wanted to give back to society in that way by caring for people. And we've even before Corona, even after Corona, that's basically every doctor's passion. I think what the public, I don't know what the public perception is of doctors and nurses. And I can wholeheartedly say the people that I work with, they're always just try to do the best for patients. They always go the extra mile for patients. I think sometimes people are frustrated because there's this, you have to think about it, there might be one doctor for 30 patients sometimes, 35, 40 patients. And we just have to like, just try our best for everyone. Sometimes you have to stay behind. But yeah, you take the oath, and that's what comes with it. You have to, you know, through good, through bad, through whatever, you have to dedicate your life to helping people, and that's what we've signed up for. So that's not the problem at all. That's not, you know, we'll do that happily. It's just obviously we don't want to spread that to a family member, to a loved one, you know. So this is just perfect. This is ideal for us to have this accommodation, to be able to do our jobs and not have that in the back of our minds.
That's it. And it's in everyone's interest as well, because if you've got the proper protection gear, the PPE, then you're less likely to catch it. So you can keep on doing your job and saving the public. If you can't turn up to work for 14 days, it's going to cause an issue. And if everyone's having that same problem, there's going to be no one to treat anyone. And that's when you get messy.
That's exactly. I think what someone needs to ask, you know, people who are higher up, or people who are managing the situation, is what's more cost effective, providing PPE adequately or having people off for 2 weeks self-isolating? I'm pretty sure like that the most cost-effective way of managing the situation is providing adequate protection to all of the frontline healthcare staff, so that they don't have to go off sick and they can still do the job, because they're going to have to bring another person in and they're going to have to pay them locum rates or triple, you know, the normal rate. That's going to be less cost-effective, basically.
Yeah, no, 100%. And this virus is a bit of a madness. Like what it's done, like it's going to change, I think, a lot of things long term. And I think we'll go into that now, because we've seen, like for me, I'm lucky to be able to work from home. Yeah, so the situation, you know, we're all in now, it could change, you know, a lot of our lives, you know, long term, if we do come all out of this, and hopefully we all do. You know, myself working from home, I'm able to with a laptop and just kind of keep on doing my normal job. And a lot of us have discussed it at work about how, you know, we could do this in the future long term. But yeah, how do you think, aside from work and everything, how do you think this could change a lot of people's lives long term in the community?
I think I think it'll change. I think it'll change a few things. You know, depends on what specifically, but I think people have a lot more of an appreciation for the NHS now. That's for sure. I think maybe people realize more that the NHS has been not been funded properly for a prolonged period of time, and I think more people, I think especially, are aware to that now, and I think more pressure will come on the government through the media and after this crisis. Because I think after it, I think when it does eventually spill over, I think people will be very, very appreciative about, you know, the care that NHS has provided for people. I think it will become a very, obviously it's always been a national treasure for us, but I think it will just reiterate that for people. And I think that I think people will realize that, you know, this is something that we want to keep, something that we love. This is probably one of the best things that the United Kingdom, you know, it has done. And people look across the world, they look and they look with envy about what we do. It's not an easy thing to provide, you know, all medical, you know, at your need, whichever needs you have, you know, just to provide all medical procedures, surgeries, medication, you know, whenever you need it, then it's there. Like, it's crazy. If you think about it, it's actually, because if you go to America, obviously they have insurances and everything like that, but the actual cost of a surgery, I don't know how much it is. I don't know. I'm hearing figures for patients with cancer, chemotherapy, whatever it is, 60,000, 70,000, 80,000. And that could ruin somebody's life. That could put someone into so much debt, and everything they work for could just basically. But thankfully here we take it for granted. You know, whatever you need, if it's a surgery, if it's chemotherapy, if it's anything, then, you know, it's all here. I think people really, really appreciate that, and then maybe there'll be more going forward to try to fund the NHS. I think people will also, you know, I think they'll be more aware about the threat of a pandemic and of a flu, because this thing is bound to happen again. This happens if you look at history, it happens every so many years. And, who knows, this might have not been the big pandemic that happens every so years. There might be another one, in 10 years time, 15 years time. If not, then it'll happen. It happens every year. If you look 100 years ago, I think the Spanish influenza, I think it killed, I don't know how much of Europe. I think was it, Abdullah, half of Europe?
I think it was 50 million people, I think, worldwide. So yeah, it was a lot. It was like a ridiculous, a stupid number of people.
Yeah, exactly. And then maybe they'll realize that the threat isn't a nuclear threat, or the threat isn't warfare. It was not. I think they realize the threat is actually, germs and that kind of thing.
Yeah. It's true. And, on that note, what we take for granted, like the NHS, you're sitting in the supermarkets with the food and the toilet roll and all that stupid stuff. But even that we take for granted, and hopefully we come out of this at the other end, and, we're not wasting as much food, and we appreciate the water we get from our taps and from the bottles, and we're not wasting that, and just basic stuff like that. And also like just the freedoms as well, being able to go out and walk and go to the park, go to the cinema, go to a football match. You know what I mean? These kind of things we take for granted, and we've got to treasure every moment, because you've seen now, like you said before, one day you're in hospital, the next you're in the mortuary. So you have to appreciate every single moment. But yeah, I think the increased sense of community as well. I think that feeling of helping someone and the buzz you get from it inside and the smile you see on their face. Say you've got an elderly neighbour and you're helping them. Like, obviously the government was asking for volunteers for the NHS and only need like $250,000, but now they've got like $750,000. So it does show people out there willing to help, but I think because with social media and the internet and mobile phones, a lot of the kind of community spirit has kind of dissipated over the last few years, and the heads are down now. Instead of talking to people, even the next door neighbours, a lot of us don't know our next door neighbours, which is mad when you think about it. But I think that sense of community slowly this could open our eyes and like show us that we need to care for those that are around us first of all. Charity starts at home.
That's exactly it, man. It's exactly it. I think we all needed something to bring us together. I think for too long it's just been everyone fights their own. Everyone has their own fight, and it's just been a bit of a
dog eat dog
free for all.
Yeah, dog eat dog free for all.
And now it's just we're all bonded by this virus. Yeah. So we all want to get past this, and for everyone's loved ones to be okay. And we're just trying to everyone is in this together, and it's nice to see, because I've seen these volunteers in the hospital. It's very, very heartwarming. People giving up their time, even potentially putting themselves coming into hospital, putting themselves to risk just to help out, just to help the patients, to make sure, and people in the community doing some really good work as well. So it's very, very heartwarming. It shows that we can be more of a community, we can be more of a big society. I think there's more that brings us together than there is that separates us.
100%. Even the environment itself as well. Like you're seeing in Venice, in the canals, you can see the fish now, because of the lack of pollution. You can see like just basic things like that. Like it is mad. The ozone layer, that's improving now. Like it's just crazy when you think about it. Like the stuff we take for granted, but then also the impact we're having because of our daily lives, traveling and commuting and all this kind of stuff. It does have an impact on the environment when we're all doing it. But when we're all having to stay indoors and we don't have a choice, we see the kind of benefits it does have. So I think the message is, when this is all over, we can't go back to the way we were. Things have to change slowly, but they have to change. They have to change, because otherwise we'll go back to how we were, and things will just, like you said, the same thing could happen again, and we're in the same position, and we're not as prepared for it.
Yeah, exactly. The other big thing is, man, how I said we're reactive, not proactive in this situation. What's the other major issue that's the whole world is into? Global warming. So we're all in that together, and we need to be proactive and not reactive. So when stuff happens, when there's floods and when there's extreme weather and everything like that, then that's not the right time to be, putting measures in place. At this time that people take it seriously, realize that people are specialists in this, they study this, they know, they're predicting this thing to happen. It doesn't, this is not just a fairy tale. This is not just people making it up. This is people saying that this is going to happen. We need to take measures to stop this from happening so we can protect. It might not be us, but it will be our children, it'll be our grandchildren, it'll be the future generations. And it's selfish of us to, just be like, oh, that doesn't really, apply to me, everything like that. But, imagine if our, imagine if our grandparents or whatever were like that as well, we wouldn't be enjoying the world as it is right now. So I think we just need to we need to be proactive, we need to take precautions, and that's the kind of thing that we need to do.
That's it, man. 100%, 100%. But yeah, we'll have to leave it there, unfortunately, to make it easier to upload. But yeah, man, what's your trim saying?
What's what?
What's your trim saying, man? When's that coming?
Bro, man, that's a different situation, man. I tried to put out a call for my barber and he declined it straight.
Yeah. That's another tricky one still. But yeah. No, the climate change one, it is a massive topic, and obviously I'll do something separately on that. But yeah, man, it's been good catching up with you. Stay safe, man. Any final words of wisdom for the viewers?
I didn't have time to prepare, man. I don't know, man. Just like, stay home, man. Stay home, save lives, and that's it, bro. That's it.
I thought you might say that one. That's a doctor. I was waiting for that. But nah, man.
What else can I say?
That's it, exactly. What else can you say, man? But nah, good catching up with you. Same as always, guys. Like, comment, subscribe. You know the drill. We'll see you next time. Take care. In a bit, Kaleem. Nice one.
Safe, man.